if a cis person needs a root canal, and they're going to their dentist, I don't think that they think, oh, how is a dentist going to perceive my gender?
No.
They're worried about, is it going to be painful? Of course it is. Or how long am I going to take to recover? And not, how is the receptionist going to look at me? Are they going to give me funny looks because I don't match the gender on my record?
Hello, globies. Welcome to the World Health Investigation podcast. My name is Jocelyn.
I'm Edna. We are young global health professionals and your hosts for the World Health Investigation podcast.
Also known as the WHI, we will be discussing all things global health, unpacking the most controversial health and social issues,
as well as promoting new wave global health development and equity.
So, Adina, what's the tea in global health today?
We have a lot of tea today, but before we even dive into that, we have a very special guest.
Beautiful guest.
Say hello to Yasmeen.
Yeah.
Yasmeen is a GP and she has experience working in a transgender and non-binary clinic.
Yep.
Yes.
Yep.
Say hello to the peeps, Yasmeen.
Hello, everyone.
Very happy to
tell
have
us a bit more about yourself.
Yeah, so I am a GP. I trained as a doctor, and I work primarily with trans and non-binary and gender non-conforming people who want to access gender-affirming care. So, yep, that's the summary of what I do.
Perfect. I guess that leads us to our topic of today, our main topic. We are talking about healthcare for trans people or transgender people and non-binary people and non-gender conforming people.
Yeah, because trans is an umbrella term that covers a range of different gender identities or lack of a feeling of gender. So it's I think today, as we use the word trans or transgender, we mean the all-encompassing term of transgender people, non-binary people, gender non-conforming people, or agender people even. So just
Come at us with the
exactly
facts,
perfect. Y'all see why Yasmeen is here today.
This is why we need her.
Yasmeen is here today for a reason.
Otherwise,
So we'll start with our case study, and this is something Yasmeen actually flagged to me. I didn't even know about this. And like when I looked at where the place is, literally like 5 minutes down the road.
We have a building at the uni that we go to. That's in Tavistock place.
It's crazy. It's right there. So this is a story about how the NHS decided to close the Tavistock Gender Identity Clinic for children. So this happened earlier this year, July 2022, like this summer.
Very recent.
Very recent. I didn't even know about it. So the NHS shut down the Tavistock Centre, and it is a gender identity clinic for children. After the foundation was criticized by an independent reviewer. So to tell you a bit about like the Tavistock Clinic, it is named the Gender and Identity Development Service, and it was launched more than 30 years ago to help children and other young people struggling with their gender identity. So in this critique that came out, the service was criticized for its care of patients of both inside and outside the clinic, if I understood the situation correctly. And it was also criticized for having really long waiting lists. So doctors reported concerns that some patients were referred onto a gender transitioning pathway too quickly. This was the other concern that was raised. So we have a quote here from like the senior NHS source who was speaking to The Guardian where this article came from. They said the aim is to close the Tavistock Clinic by spring 2023 and move to a new provider model through specialist children hospitals is the idea. And so the children being seen at the Tavistock place currently will be transferred to a new provider, over the time. So I think what I found most interesting in this article was like they specified the doctor specifically was making the recommendations. Her name is Dr. Hilary Cass. She's sort of the lead person on this independent review, and she said that there was insufficient evidence for her to make any firm recommendations around the routine use of puberty blockers. She told the NHS to enroll young people being considered for hormone treatment into a formal research protocol with adequate follow-up into adulthood, with a more immediate focus on the questions regarding puberty blockers. And then they actually spoke to someone. Her name is Kira Bell, who's 25, and she brought a case to the High Court against the Tavistock Clinic, challenging the use of puberty blockers. And she said she was very pleased with the decision. She is over the moon.
Yep.
Yeah. So quite a brief there. Thoughts, reactions, comments. Yasmeen.
I have plenty.
We'll start with you.
Yeah. So just to sort of to move from the last thing that you said and to where things started. The case with Kira Bell is she's a person who, when she was younger, wanted to access gender-affirming treatment, as back at the time she believed that she was a transgender boy. So someone assigned female at birth, and so shall we get into the terminology?
I
now?
think we should get into the term.
Yeah.
It's about time. It's
Yeah.
about time. So,
Uh,
and I'll have Yasmeen guide me. So,
Yeah.
I thought we should start by defining sex.
What is sex?
What is sex? When we say sex?
quite simply, because you'll find plenty of discourse on this. Quite simply, when a baby is born, doctors will, or before they're born, like
Yes.
through ultrasound, they'll look at their genitals and then they'll determine if this baby is a boy or a girl. And so sex is determined based on the external genitalia, how your chromosome makeup, so XX or XY.
Yeah.
But that, from the very beginning, there's a very binary aspect to determining sex,
Yeah.
because it excludes people whose genitalia are ambiguous, so intersex people, for
Yes.
example. So there's a lot that we can go off on a tangent there, but sex, quite simply, is biological and assigned at birth. That's the terms that we like to use, that are more inclusive and mindful of people of all different gender identities. So rather than say biological male or biological female, we use assigned male at birth, for someone who is trans feminine, and assigned female at birth for someone who is trans masculine. So yeah.
Yeah. Perfect.
Back to Kira Bell though, very quickly. So it's because it's a very politicized issue, the treatment of young trans people.
Yeah.
And so Kira Bell accessed gender-affirming care through the NHS, and then a few years later, she brought there was a court case against the Tavistock that they allowed her to get puberty blockers and testosterone, and some of the effects of hormones are permanent.
Yeah.
And so now she was thinking that I should not have been cleared to get this treatment. And so there was a ruling that children cannot consent to accessing puberty blockers or gender-affirming treatment. And from that came up the need or recommendation to make things slower for young trans people, which is an issue in and of itself.
Yeah.
A huge issue, but
Yeah.
that's
In brief, the situation. Thank you for that context. Okay, so we've talked about sex. I just want to make sure that we're all on the same page.
Yeah.
'Cause I also have to take the time to break it down. I wanted to move on to what we mean when we speak about gender. So, Jocelyn, I'll start with you already. What do you understand by gender?
My understanding of gender would probably be what society has determined that gender is, a social construct. So, as Yasmeen just described, you may be assigned at birth a particular sex, but then you feel like you're not of that sex, right? So you are of a different gender, essentially. So my understanding of gender is, yeah, it's a social construct. That's literally what I have to say.
Yeah. For me, the first thing that I thought, like, these days I actually struggle a lot to like understand, like, okay, when we talk about masculinity versus femininity, those are the first things that come in my head of like, okay, gender to me is when you know, it's certain behaviors that we have associated with like being a man and being a woman, but it is just that like associations, and I feel like it's so vague because you start to see people where it's like, okay, they may behave in more feminine ways, but that doesn't make them less of a man. Or it's a woman and they behave in more ways that we consider masculine, but that doesn't make them less of a woman.
Yes.
You know?
Speaking of, just to add on to that, I think gender, I always see these videos on how to channel your femininity, how to embrace your masculinity. And I'm thinking, I don't want to hear that. I don't, obviously, like, I identify as a woman, right? I'm a cis woman, yeah? But doesn't mean that I necessarily want to be told that this is how you should behave. I would say I have characteristics in my behavior would pass as, okay, she behaves like a woman, quote. But then when I see these videos sometimes on YouTube, I feel, even I as a cis woman, I feel a lot of pressure. I'm like, okay, you need to, you know, be pleasing, soft and pleasant, and dress a certain way, and wear orange, and you know, I've heard that before.
Orange specifically.
I hate orange. I don't like that color at all.
Wow.
I never want to dress
You
in
know that's
orange.
the color now.
That's a brown color. What you?
Hey, we're cutting this part out.
It's okay. We'll get her.
It's closed.
We'll get her to love it. We'll get her to love it anyways. But this is not about the color orange. We're speaking about gender, right? But then these associations, like these colors, this behavior, the way you speak, the way you dress, the way you walk, that can essentially determine how the society you live in perceives your gender.
Yeah. Yasmeen, I don't know if you have anything to add about what gender.
I agree with both what you guys said, but I would add that for some people they think of gender as what your body is biologically able to do. So, but those are what we would call gender critical people. You know, so for them, being a woman is having a female reproductive system and being able to bear children. And so there's, you know, oftentimes this will be a point of criticism for people. It's like, no, gender and biological sex are one and the same, and you cannot change it. You cannot act differently. Even if you transition, you're still a woman or still a man, even though, and just because someone has specific organs inside of their body or outside of their body, that doesn't mean that, you know, it doesn't make them the gender that they identify with and who they really are.
Yeah.
So
I just had a follow-up question to this. It's like, do you guys then think that like gender is fluid?
Yes.
I'm a yes too.
I think for me personally, I'm going to be honest, I don't feel fluid in my gender, but I understand people that would say, at a certain part of my life, I felt more, like maybe like a teenager would say, okay, I definitely want to, you know, I feel like I'm meant to be a woman. And they grow up and say, I actually want to even transition and get that gender affirmative care. So I think I've heard different trans people say that it sometimes varies, like the way they feel as well. It can vary quite a lot. So I can understand why, yes, gender fluidity is a thing. Yeah, it is.
Yeah. I would agree because it's you know it doesn't necessarily, it's not necessarily my experience of how I perceive my own gender, but I completely understand people who do feel that way.
Yeah.
And I don't know. I don't think it's I don't think it should be up for debate.
Yeah.
That kind of stuff. Yeah, but then maybe I'm very passionate and opinionated about it.
If we're to make it a debate, right? I think the argument that I've heard, right, is that that if you're claiming that you feel gender fluid, sometimes it's not necessarily about your feelings. That's what it's like okay, with biology, it's like you can't necessarily put feelings into biology because feelings always change.
Yeah.
That's the argument that I've heard people saying, is that okay, with biology it's literally the XY chromosome and we have this sex, and just because society has imposed like gender roles and whatnot, you're particularly angry at society, but the way you feel is not necessarily the way that your actual physiology is.
Yeah, because I would say it's very clear in the naming. It's gender fluid, not sex fluid. So I mean, no one is claiming that they can change or be fluid in their biological sex. But in their gender identity and their gender expression, that can be fluid.
Yeah.
I would definitely agree with that.
Yeah. Like I said, I just these days to even try to think of like, okay, what does it mean to be masculine? What does it mean to be feminine?
Yeah.
It just feels very arbitrary to me nowadays. I think
yeah.
based as well on like just different types of men and women that I've seen, it just like honestly, it almost doesn't matter. It's like you can just be as.
And that seems to be a question that people always ask of trans people rather than cis people as well, because no one walks up to a cis person and asks them, what does being a woman feel like to you, or why do you want to be a woman, or prove to me that you're a woman, or prove to me why I should treat you as a woman, but it's always trans people who are being put under that microscope and in some cases denied basic rights like accessing healthcare, for example, just because whoever is on the other side of that conversation is just like, I don't get it, therefore I'm not going to entertain the fact that there is a human being who just happens to be trans and they need help or they need care or they are just living their day-to-day life. So
exactly.
And then just quickly to add on to that, I think even beyond even the trans community, we've seen that even like the cis community, we have understood that gender roles can be problematic. Like just that binary, we know just because I'm a woman doesn't mean I particularly do all the things that women are perceived to do. It doesn't mean that. Even that personally, I don't feel I have embraced.
Remember that book we were reading by Chimamanda Ngozi Adichie, and there's that line we liked. It was what, like, my vagina does not come pre-installed with an instruction manual for cooking. Or something like that.
Yes.
You know what I mean? So that's why to me things end up being ridiculous. Like, what does the vagina have to do with like cooking or taking care of?
Nurturing.
Naturally nurturing.
Naturally.
I'm sure everyone knows people in their life who, like, just for lack of just to generalize, who know women who are not nurturing, and they know men who are very nurturing. And even if someone is in the quote unquote regular family setup, which is a cis mom, a cis dad, and then children, you like the roles of being a mom or a dad aren't fixed.
No.
Society has told us that they should be fixed, otherwise you're a bad mom or a bad dad, and it all happens to be you're always a bad mom. No one ever. I don't think I've ever like heard of people criticizing men as being bad dads, but not that I would want that to happen, but that's a story for another time, I guess.
The bad dads are just the ones that are not there.
Do you think though? I think but that's one extreme though.
Yeah.
So I'm thinking the bad dads are the absent father.
The deadbeat dads.
It's but anyway, it's like gender roles or roles of a parent, they can vary greatly.
Yeah.
So mom doesn't have to be the one who cooks.
No, tell them. Yeah, like for me, the other thing as well is to also point out, like, I've seen people as well who are very comfortable fitting into the like traditional,
Yeah.
like gender roles. Like a
That's-
woman who will be like, you know, my husband, he's the one that earns the money, he's the head of the house. I'm a housewife, I just stay at home and take care of the kids. I'm happy to make sure dinner's ready for him. That's just how we do our things.
And just to add on to that, I think me personally, I actually grew up in a very traditional family where my mom, and she did work, but at the end of the day, it was her that did the cooking, and even if she didn't do the cooking, she was kind of assigned to be taking care of the micromanagement in the household, the kitchen, the decoration. It was her and my dad working, right? And being the main breadwinner. And even with that, I've seen it being problematic, you know? And I also see that in many African households, it is a thing that our assigned gender roles that do work. Like we've seen it does work. But I do think, in particular in today's society, the way we work, the type of jobs that we do, it no longer really caters for gender roles. It's very difficult to be a full-time mom with a full-time job, with doing all these things in the kitchen and coming back, and if you're a dad, if you don't know how to cook, it is a mess. Yeah. So just to stress what you said earlier, that I think with gender roles that we've seen that even more traditionally it can become quite complicated.
Yeah. So I guess just to keep it moving, we have gone into sex, which is more to do, you know, biological and physiological characteristics, and you know, sex assigned at birth. We have gender, which I think we're all like, okay, it's just societal norms and behaviors and traditional ways we think about a man, a woman, how they behave. Now, gender identity. What's that?
Tell us, Edna, what's that?
So, gender identity refers to a person's internal and individual experience of gender, which may or may not correspond to the sex they were assigned at birth. So I think Jocelyn even alluded to this. It's like how inside you just feel your gender is.
If I can jump in here and say that, you know, if to simplify things, someone can be cisgender or transgender, and that, so if my gender identity matches the sex that I was assigned at birth, then I'm a cisgender person. So for example, I'm a cis woman because I was assigned female at birth. I identify as a woman. I'm a cis person. For someone whose gender identity doesn't match what the sex that they were assigned at birth, they're transgender. Keep in mind that trans is an umbrella term, like we mentioned at the beginning. But it's very simple, really. You know.
I think I think, to be honest, I feel like it's quite simple to us, and quite simple to me, just because I've grown up like here in the UK, Switzerland. But I do feel as if like maybe some of my family or people I know back home will just by the time you get to gender identity, you've lost them.
No,
So,
I think it's good that we need to break it down, because we're speaking to a very, very wide audience.
Okay. And then I think the last thing to touch on, because I feel like sometimes people are like, okay, now where does gay and lesbian come in? So what is sexual orientation? Sexual orientation is just more to do with who you're attracted to, right? Sexually, who are you attracted to? That's pretty much it.
And it doesn't have to do with gender.
No.
It's, I mean, because for people who are like, you could be a trans woman, for example, and be a lesbian, because you will, if you're sexually attracted to other women, then you're a lesbian. You're not a straight man who is deciding to be a woman. No, you're actually, so it's really separate. You could be a trans woman and be straight because you'll be attracted to men. So
Yes.
honestly, removing the cis or trans part of the label, and then looking at a person.
Mm-hmm.
If they're a man who likes men, they're gay.
Yeah.
If they're a man who likes women, they're straight.
Yeah.
If they like both, then they're bi.
Yeah.
So it's really, it doesn't have to do it, like, skip the cis or trans prefix and focus on the person themselves.
Yeah. Perfect. And I'll just quickly go through this because I am always aware of the impact of colonization on our worlds and how this has also, impacted gender identity, and how we look at different gender concepts. So I'll just do like a quick run through. I'll link to resources. I'll just reading around like different concepts of gender around the world.
Yeah.
So for example, in Thailand we have the Katoi. I'm probably pronouncing that wrong. And normally in Thailand, this is a transgender woman or transgender women and effeminate gay men. And a lot of the times you find that in Thailand it's quite normal. They can be very high profile people, models, actors, singers, TV personalities in Thailand. We have the Hijra that I came across. And this is actually a third gender that is acknowledged in Hindu society. So you actually look through like ancient Hindu texts that are like thousands of years old, and you have references to people who are Hijra, and it's really acknowledged as like a third gender. And usually these are people who are born male, but they look and dress in traditionally female ways. And sometimes some of them, but not all of them, will actually go through a ceremony where they'll like castrate themselves. And they'll remove their male genitalia as an offering to the goddess Bahuchara Mata. What I thought was interesting was actually like in 2014 in India and Nepal and Bangladesh, they actually officially recognized Hijra as like the third identity. Yeah.
I can hear people protesting to that already. No, not like
which people?
The transphobes. Transphobes of the world.
Tell them. Then if we move to like the North Americas, we have the idea of two-spirit, which you find a lot in indigenous American communities. And this is the idea that you have people, naturally born, they have both male and female spirits. And actually before colonization, the two-spirit people were included and were very respected within their communities and valued members. They would, have roles as healers, matchmakers, counselors, among other things. Then the last one I found was the Sekrata in Madagascar. And these are typically effeminate men. And what I found interesting was that sometimes it can even be identified from a young age. So young boys who are believed to exhibit feminine characteristics are considered Sakrata from like really early on. And once this identity has been assigned to them, they'll actually, raise them wearing like jewelry, traditional women's clothing and styles, and this kind of thing. So, gender around the world.
Gender around the world.
Please, and like I highly encourage people to look into it. There's so many that I didn't touch on, and there's like really interesting history, especially about like before colonization, after colonization. Really worth thinking about. So guys, we're here, global health professionals. Why
young
global health professionals?
Very young.
Yeah.
Look at us.
Why should we care about trans people?
Because we should.
I think because global health professionals should care for any group of people who are underserved, and trans people are underserved in many countries, both high-income countries, low-income countries, and so it's a deficit that we have that we need to address.
Yes,
100%.
From my perspective, I always go back to universal health coverage, access to care, no one left behind.
No one.
Yeah.
And to me, I always preach that, like, no one, not the children, not the women, not the trans. not trans people. And I think that sometimes I don't hear about it a lot in global health, to be honest. I think I always see like issues around, I don't know, like food or like healthcare, but not specifically for trans people. So yeah, I just think that if there's a need for it, there's a demand for it, then it should be addressed.
Yeah. I really like what you brought up about, no one left behind. Yasmeen, what you said as well. And for me, it's always a reminder as well when you also think about a lot of like gay liberation movements, civil rights movements in America. It's like trans people were very instrumental in those, and they were there in the streets as well, fighting for everyone's rights. But when it is now their turn, we don't really fight as hard for them. So I think it's really important for like everyone to really, to care about this. So let's just dive a little bit into like what is the experience of trans people when it comes to healthcare, their health needs, discrimination, criminalization. There's a whole range of things. We won't even dive into all of it. So I thought, why not start by actually hearing some, testimonies from different trans people and their experiences with healthcare, because I was quite shocked by what I found. So I don't know, Jocelyn, would you like to kick us off?
So this is a message from Robin, preferred pronouns she, her, hers. In general, I've been blessed with a good primary care physician and an endocrinology doctor. But I was seeing a specialist for a different medical problem, and my records and everything all said female. I have everything changed, and the guy looked at it and went through all those steps, and then he said, "So do you dress full time as a woman?" I was stunned. It's like, do you dress full time as a man?
Yep.
Yeah.
Yeah, it's always good to reflect the question back onto the people who ask them, like, oh god.
Like, don't get me started.
Yeah. So our second testimony is from someone called Gray, preferred pronouns he, him, his. And Gray says that the biggest horror story that I had was going to the pharmacy to pick up my first testosterone prescription. I was nerve-wracked already because it's like such an emotional thing to like finally get the golden ticket. Ends up being like $1, so it's just the syringes. There's no medicine. 4 people later, in about 20 minutes, they finally look it up in the computer and they're like, oh yeah, oops. Throughout the entire process, I had to say my legal name, which isn't the name I go by, out loud to the whole entire store.
Oh no.
And I'm basically outing myself to everyone around me.
Yeah.
And that's not wanting to hide. That's just about staying safe. Like some people hear that and they might follow me to my car and bash my head in.
And the last one here is coming from Ethan, preferred pronouns they, them. The way that it's set up, at least to even access care as a trans person for being trans, is an issue. Just walking into a medical clinic gives me a lot of anxiety because I have no idea what I'm going to be asked or even how to fill out paperwork. I don't know if I'm going to my endocrinologist, they're looking for me to write F or M because I don't know what they're looking at. Are they asking about testosterone levels? Do they really need to know exactly what my chromosomes are? Yeah. So, any particular ones that surprised you guys?
I mean, none of them really surprised me, but the one that stood out to me was probably the second one, Gray. Though, like, obviously, thinking at it like as a healthcare professional, if you're going into a hospital, you're expecting a patient, you don't necessarily think, oh, they could be worried about their safety. You don't really think about that. Obviously, I always I'm aware of sometimes the threats that people give to trans people, which is absolutely unacceptable. But to think of it even as at a hospital, it's like that's the one place where you should feel safe. But no, it's not the case.
Yeah.
And I think that is so it should be kept confidential. You don't have to disclose that kind of information if you're not ready to yet, especially considering the society we live in, especially with like the trans people being attacked and even like with homophobia and transphobia going on. So yeah, I think that's what stood out to me.
Yeah.
Yeah.
How about you?
I'm unfortunately not surprised with these stories because regardless of where these three people are in the world geographically, the experience of trans people in healthcare, the negative experiences are very close to one another in that, you know, it addresses confidentiality, privacy, safety, which are three basic just human rights for anyone, especially so if you're you know, in a healthcare setting, if you're in that vulnerable position of wanting any kind of care, that shouldn't happen. And I think one of the main reasons why this is often the case is there's no formal education program for, you know, concerning trans issues, trans healthcare in medical schools, in nursing schools. It's something that, if it happens, it's usually self-led initiatives by people in the workplace who will want to educate other colleagues on this. So it's if doctors, trainees, healthcare professionals, pharmacists, all these people, you know, that who come in contact with a patient or a person who's accessing care, if they're not aware of the simple things like being mindful of pronouns, not outing someone, not on purpose, you know, just if someone's legal name in the healthcare record is different than what they go by, to actually respect that and use it, so that, you know, it's a struggle for a lot of trans people at the very initial step of contact with of any healthcare professional in a healthcare setting. So
for me personally, the one that stood out was actually the last one. Ethan, who was just had anxiety about how to even answer paperwork. And this is not one I included, but I linked to in the description. It was actually about trans adolescents, and I remember one of them saying that they felt as if when they went to a clinic, they were educating the doctors more and speaking more about their own experience than the doctor was trying to actually help them with the issue that they came with. And to me, that is just like, I feel like there's just like that disconnect between like the trans patients and doctors in terms of like, the doctors don't know what's going on. Like Ethan is highlighting here, he's also not sure what's going on because at least classic, you're right, oh my god.
And that's it's fine to, you know, whenever you use someone's incorrect pronouns, you just use the right ones. Apologize. Don't make a big deal out of it. Don't draw attention to it, and go on.
They were talking about, like, I feel like classically in medicine we always talk about this like asymmetry of information, right? Where like the doctor typically knows more than a patient. However, like we're seeing with a lot of trans people, it's like sometimes the patients may end up knowing more than the doctor. And now you're also like, but I still don't know what the doctor wants to know. And what I need to tell them.
What he or she is supposed to know. I think I'm not surprised. It is very sad because the one place where you should feel safe is a hospital. Like, I get it, right? Society is messed up. We've agreed, but the one place, that one we can all say yes. But then the one place, at least the medical professionals, like, you should be trained for these things. Like, even when I remember I did my bachelor's in medical science, I never learned anything to do with trans healthcare. None of that, right? And I only like did it like in an internship where I actually had to go ahead and learn like the barriers to healthcare for the LGBTQIA plus community. So I think that to me it is quite shocking that why do you not have that in the curriculum? Why? No, genuinely, like why? That's my, like, genuinely.
I don't know. I don't know.
Yeah.
Because one of the first things that you get taught in med school when you're doing your clinical rotations is how to conduct an interview with a patient or discuss their history with them, their presenting complaint, regardless of what it is.
Yeah.
And it's a very basic thing to ask someone how they would like to be addressed, what their sex is, what their gender is, and that's not covered. That's not covered anywhere.
Yeah.
So now if you don't have protocols, processes in healthcare facilities and healthcare settings on how to deal with people of all genders and ages and every different thing, it becomes up to the person themselves and their opinions, their beliefs, whether they are siding with or against trans people. And that's not proper care. If you don't have standards, if you don't have rules, then it's just up to every person, and that shouldn't be the case, because what if someone one doctor is very trans friendly, they're understanding, they're aware, they've done their self-education, but then the other is absolutely not, so there's a deficit there.
Yeah, no, that's what I found quite shocking of, like, I think the overwhelming thing when it came to barriers was this perceived or like almost assumed stigma that you might face in a healthcare setting in particular. So many people were saying, no, I don't go to the dentist. I don't do any of that. I don't schedule, pap smears or whatever it may be that may be necessary because of that stigmatization. And I completely understand, because even me, I would say, I'm actually not sure if the doctor would understand. Like, I don't know how they're gonna treat you. You also don't know how the doctor is, like, in terms of their own personal views. Like, they might be transphobic, and you wouldn't know. They're just treating you rough, and you're like, what's going on?
Honestly, and the very simple and practical example is if a cis person needs a root canal, and they are going to their dentist, I don't think that they think, how is a dentist going to perceive my gender?
No.
They're worried about, is it going to be painful? Of course it is. Or how long am I going to take to recover? And not, how is the receptionist going to look at me? Are they going to give me funny looks because I don't match the gender on my record? And things like that. So it's stuff that it's a privilege that cis people have and they don't think of. But trans folks do, unfortunately, and imagine if you had barriers at every step of the way, and always wondering, am I going to be safe? Things like that. Because safety is a huge thing.
Yeah. And I feel like we even see this as a problem in high-income countries, which normally seem to be very like accepting and tolerant. Like, now I think about, what about in the middle-income context? Like, would you even dare, try find, like, I don't even know what you would do.
I know it made, like, I think about, is it about 30, something in the 30s out of the 52 African countries that don't even, I think they don't prohibit, they don't even allow homosexuality.
It's criminalized, punishable by death in some countries.
So it's I think in many it's quite
I mean, I personally can speak from like the Zim context. It was an article I was just reading as well, just to try and understand, in a low middle income country, like what is the journey there, and specifically in Zim. So it's not as if there's a law particularly criminalizing being trans. But there is just gray areas in the law. What is very clear is like homosexuality, having sex with a man and stuff like this, that is criminalized. Yes, so Zimbabwe is one of, like you're saying, Jocelyn, 32 African countries out of 54 where same-sex intercourse is outlawed. And there was actually a case I was reading about a woman in Zimbabwe where she entered a woman's bathroom and she was charged with a criminal nuisance. So this is just like giving the context there in Zim as to understanding, okay, in such a context where you're not even accepted, there's a lot of discrimination, how do you even exist as a trans person? Where do you find care? And I see that, I was seeing in the article that many people will actually like smuggle in like hormones, for example, from neighboring countries, Botswana, South Africa, and the major concern there was, Yasmeen, you may know better, is that hormones, they have a particular shelf life and like a temperature which they need to be kept at.
Some forms of them,
But when it's being smuggled, you just generally have no idea where it's come from. That's and just to quickly reflect on how things are in Egypt. I'm from Egypt, and how trans people can access care, but only through specific government hospitals, because otherwise you wouldn't complete the steps that they have for you, that they force you to go through, and because at the end you need the paper that allows you to change your legal documents. And the funny thing is, in a very sad way, I mean, is that trans people in Egypt, some of them will, if we get over you know how some trans people are stigmatized by their own families and kicked out of their home. So if someone is lucky enough to have a supportive family or is able to access that care, and they go through their assessments, they go through hormone replacement therapy, they even have gender-affirming surgeries, but they still have an identity card that says male, even though they're quote-unquote fully female, and fully female in the eyes of the Egyptian healthcare system. And you can only imagine how that is like if you get stopped by a random police search, which things that happen in my country, unfortunately, and you don't match, you're going to get, and trans activists in Egypt have been thrown in jail. That is not so. A very famous trans activist, Egyptian trans activist called Melek Akeshif, she was imprisoned in a men's prison. And she's a woman, but because her identity card said man and had her old name, so it's like, you know, things aren't.
Can't imagine being dropped in a prison of men identifying as a woman. I feel like they're just dropping the lines.
It's
there.
dusty.
Yeah. Oh my days. But yeah, I always had a question in terms of, if you identify as trans, is it necessary to go through with a gender reassignment surgery?
No, you don't have to. It really depends on what every person wants from their transition. What they, because not all cis people are the same. Not all trans people are the same.
Surprise.
Yeah, exactly. So not everyone wants gender-affirming surgeries, and gender-affirming surgeries can just summarize it to, like, you have facial surgeries, you have top surgery and bottom surgery. That's, you know, things like breast augmentation. Not every trans woman wants that, because maybe they'll achieve breast growth from hormones. But I would say from experience is that most trans men or trans masculine people will want top surgery, which is surgical removal of the breasts, because of how dysphoric that makes them feel, how it triggers their gender dysphoria, which is you know, a very serious condition. So if someone could have, not everyone is the same. That's what always surprises me when people criticize healthcare for trans people and say, oh, you want, you know, everyone should have that surgery, everyone should have that, should go through that same path, and it's not a one size fits all kind of, it's not a recipe. Not at all. So you don't have to have gender-affirming surgery if you don't want to.
I have a little sidetracking question. This is I'm asking Yasmeen.
Yeah.
What was my question? Oh, do you think that transphobia and gender and trans critical are the same?
I would say yes. I'm not sure how people who are gender critical are able to separate themselves from the transphobic movement that's happening. So for me, they're one and the same, honestly, because it can be very easy to discuss these things and philosophize them and have a debate, a discussion, but at the end of the day, how does that translate into practical, into day-to-day life? I think they're one and the same.
What for some of us here, what is the difference between transphobia and transcritical?
She just said they're the same.
Like, no, as in, like, why do some people think there might be a difference? Like, what is the debate about?
Yeah, I think it's about, with what I was reading something around, like, okay, I think transphobia, what is transphobia? First of all, let's define that term. Transphobia is any dislike, discomfort, and refusal to accept a person's gender identity, essentially. So, like, refusing to say their pronoun the way they want to be addressed and whatnot. That's transphobia. And the gender critical stuff was more around asking questions, like, for example, with the Kathleen Jenner.
Yes.
When she changed her gender, she actually had got the gender affirmative care and became a woman. They were kind of saying that, there are questions around, if you were initially a man and then you become a woman and you're still attracted to women, how do you know that it's not based on your feelings? And they're just asking, I think it's still like, one person will say, yeah, it's transphobic, but then they're just saying, okay, we need to be able to ask questions and say, for example, if a doctor is trying to diagnose a patient, right, like based on, do like a differential diagnosis and try to understand, for example, they may be at risk of, prostate cancer or cervical cancer screening and whatnot, and they're trying to look at the sex, and because that's usually how you would diagnose someone, is if they're at risk of these certain things. Like, how do you medically, like, how do you fit in those two together? Because at the end, like, biologically, it's quite difficult to separate that, knowing that, for example, if you're not able to menstruate as a trans man, then you would not be eligible for the screening. So it really, that's usually
it's interesting though, because while there are a lot of health disparities for trans people all around the world, in the NHS, for example, if you're a trans man, you can get invited to cervical cancer screening. But if your GP records show the gender marker that's female, which is so that's when the system would say, if you have that gender marker, if you're above the age of so and so, then you will get invited to screening. But when someone changes their legal marker, you can still flag that. You can ask your GP to still invite you for that screening, because if you change your gender marker, then the system won't automatically invite you to go ahead and do the screening. And the same for trans women as well. They won't get invited to prostate cancer screening unless they have the marker that says male. Or if they actually, actively seek that. And because if medically speaking, if you have the organ in your body, then you should check for diseases that could affect that organ.
Yeah.
So, yeah.
Yeah, so I think what that just made me think about was, even when I was reading around, it seemed like it was difficult even for researchers to be able to even say what proportion of certain populations were trans. And that also just had me wondering if we think it's necessary, like even in research now, when we always record male, female,
Yeah.
man, woman, like baseline characteristics. Should we now also incorporate gender identity? Do you think that's going to be
in my
helpful?
dissertation, I did do that. I had sex, like male, female, and then we had gender identity once. But that was because that was more for like a HIV study though,
Yeah.
around like HIV and COVID, because it was relevant.
Yeah.
But it might not be relevant in every single study.
I think it depends on the study,
Mhm.
what the study design is, what what the research question is.
Yeah.
Because it really will depend. Rather than, because we know that statistically speaking, it's easier to analyze a data set without getting too technical if you have less variables. And for lots of research questions, things like is heart disease more common in men or women? What do we need to ask about people's gender as well? Because we're when we ask a question like that, it's usually related to biological sex and then the hormone makeup that you will have if you are a woman or a man. There's a huge gap in medical literature for trans healthcare, and so rather than ask the question like, should we definitely need to ask about people's genders, but not for every single study. It will really depend. I would say
I'm a bit torn with this one.
Oh, okay.
I'm a bit torn because it's like, okay, should we make it the norm? Because it's because if we're gonna refer to sex, right, in the study, it's almost like we know that sometimes like we know most of the time the social life has a big impact on your health, like the social determinants of health. So now I'm reading this question, I think we should, like, for most studies, I think now I'm changing my mind.
No, it's fine.
Yeah.
I think it's it really will depend on what you're trying to figure out when you're doing a specific study. What population are you going to include or exclude, and whether or not if the question, if you feel like there's a justification to ask about someone's gender identity, then by all means include that. I would say that it is something that we should ask about in any healthcare setting, in any patient intake form. This is something that should, because you know what, lots of studies are done based on data that is already there in the medical record. And so, if we start including that, maybe in the future, because we have access to that extra bit of info, it will help us. So I think it definitely should be incorporated.
Yes, that leads me on to my next question, if I'm allowed, Edna.
Of course. All the questions.
You were mentioning around the use of let's say incorporating in the medical field, right? So now that leads me on to my question around the use of gender neutral terms in the medical field. So should we apply gender neutral terms in the medical field when a child is born?
Can you give an example or a context of that?
So I was watching this YouTube video because I really wanted to look into the experiences of trans people in Africa in particular, because I always hear of this in Europe, and I feel that there's not it's a bit of a taboo in many African countries. So I saw this documentary, well, it's an interview, I think, of this woman, this interviewer, and she was interviewing a trans woman, and one of them was a trans activist as well, and she said that she was asked a similar question, and she said that at birth she didn't like the fact that she was assigned as a man. She didn't like that. She wished she wishes she was just not assigned anything until she would decide that, okay, now I want to be a woman and I'm then identifying as a woman. So she was saying that it should be the case everywhere, where everyone can then grow and then decide the type of the gender that they want to be, they want to identify as. What are your thoughts?
The first thing that came into my head is, why would we just stop at birth? You know what I mean? Because it's like, it's not necessarily just in the hospital and the assigning of a particular sex to you based on your, genitals. That's like a factor here. It's also like about society and how society will perceive you. Obviously, if growing up as a child you look like a girl, people will start treating you like a girl, and they'll like put those like roles and expectations onto you. And if you're a boy, the same thing. So it's like, why stop at just like the hospital? Should we now impose that on like parents and people around you to be like, until the child is old enough at whatever point we decide, then they can.
I think the question is more at the hospital. Not as soon as your mother pushes out the baby, the newborn baby, should they be assigned? It's a difficult question, isn't it?
I think that assigning someone a sex at birth is necessary, because of following children up with regards to their health is something that medicine is quite gendered, very binary in certain things, and before this, something that I have to bring in here is that not everyone will present with gender dysphoria or question their gender at a very young age. Some people do, but for a lot of other people it's around the time of puberty, because that's when, so for if you're a trans man or trans boy who's going through puberty, then you're starting to get a period, your breasts are growing, and it's just, I can't even begin to describe how people can be horribly distressed by that, because I'm a boy, why am I growing breasts? Why am I getting a period? I don't want that. So, but to move back to whether we should assign babies when they're born a sex or not, I think it's necessary in how, for medical purposes, but that doesn't mean that, because a child isn't raised in a hospital or in a healthcare setting. A child is raised at home. They're in a society that has certain gender roles or expectations, and that affects how they're brought up. And so I don't see why we need to erase that label at birth, knowing that there are benefits to having that label.
I feel like you put it better. And
the question should be like, rather than remove that label entirely at birth, it should be that we should work on improving conditions so that if someone starts presenting differently, or if they start experiencing gender dysphoria at whichever age, if they start wanting to experiment with how they dress, how they act, then there should be space to change that, rather than say, let's just get rid of the frankly important label at birth, and focus on making things more flexible if someone does not fit the cis normative path in life.
Yeah, the great point, by the way. I think the reason I'm asking this question is because this woman seemed to be unhappy with the fact that she was assigned the male sex at birth. She wishes that was not, because maybe that is also contextual because she was in a place where it's quite it's not safe. So maybe that's why. But I've also seen a few cases like this where in the trans community where they say, I don't, with my children, when I raise them, I would not even disclose. You know, when they have a gender reveal, they have baby showers, they will not disclose the sex of the baby.
Yeah, that is my thing of like, I almost feel as if removing it at birth when a baby is born is almost pointless. Because it's like Yasmeen was saying, they're gonna go out into society anyway, where I feel like these gender norms will be imposed on them anyway. So it's like, you know, removing that at the hospital, to me, I think will not have that great of an impact, actually.
I think it's good to remember, like you said, Jocelyn, that things can be very contextual for people, and so you know, and similar to that woman who said that, lots of trans people will say that they wish they were born cis because and understandably because their life, they believe, and I think because of cis privilege, that their life would have been easier. They wouldn't have had the barriers in many different areas of life, you know, socially, medically, all these things, even in their families, you know. So being born cis would have been less problematic for them, and some people choose never to disclose that they're trans, except to very few of, you know, close people, and that's completely fine. But on the other hand, some trans people are very proud of being trans, and they want to show that off. They're happy to discuss that. They openly say that, and honestly, this is okay. That's okay, as long as, you know, you feel safe in disclosing that. Then disclose that if you want to. If you don't feel safe, then you know, no one should blame anyone or point fingers and say, oh, but how do you not tell people that you're trans? Like, it's none of your business.
So would you encourage, in our society now, would you encourage that parents don't disclose the sex of their baby?
No, I wouldn't. I mean, I can't make a recommendation as to what someone, you know, to do with their child in terms of raising them, because it's not, that's not a medical issue.
Yeah, I think the reason why I'm asking this question is because these people were particularly referring to like developing a gender neutral society, encouraging gender neutrality, just removing all the barriers.
You can definitely work towards becoming a more gender neutral society and removing some of these very rigid and oftentimes pointless binary attitudes. But still be able and still tell people that my son, daughter, or my child, anything that you want. But it doesn't have to be everything is gender neutral, including removing that label, not telling people what gender your child is. So I wouldn't recommend that as a whole, but I would recommend that society moves to a more gender neutral outlook with things like the names that we give to certain jobs, or how we label certain sections in shops when you go shopping for clothes, for example, and removing the just being more inclusive. It's tiny steps. It doesn't have to be. I don't think anyone is coming out and saying we need to completely obliterate gender, sex, nothing. There's no difference, because there is a difference, but it's fine.
It's fine.
It's fine.
It's fine. I mean,
Fine. It should be allowed.
yeah, it's normal to be different.
Yeah.
I think ignoring the sex might actually become more problematic. It might do more harm than initially intended, because now it's going to be like, but I want to know, like, I think they were saying that, okay, I, with my children, I will not disclose the sex of the baby or whatnot. But they're also saying that family members were really curious. They really wanted to know what sex the child is, because they wanted to come and maybe give gifts and whatnot. So I think it creates that ambiguity as well, in terms of like, just being nosy.
But that's up for every parent to decide really if they want to do that for their child or not, rather than it really is different. It's a very personal choice, I'd say, but I wouldn't recommend it as like I wouldn't recommend it
everyone.
to everyone.
I would even think for like family members that are nosy, that's the part for me where I'm like, you kind of need, like, it's good that the parents would do something like that to almost challenge people's obsession with knowing that you know. Like, it's like, is it going to change how much you love them? Like, you can buy, you don't have to buy all blue because it's a boy, pink because it's a girl. Like, it doesn't have to be that deep. Okay, I guess now we can switch over to what we can do better, what we can advise the peoples out there.
Yeah.
Who'd like to kick us off?
Jocelyn.
I just
Yes.
want to say
I like putting people on the spot.
Wow.
What advice? What can be done better?
What can we do better? What advice you have for people or anybody listening?
I think the first thing first, when I'm just thinking about the fact that the medical curriculum completely disregards healthcare for trans people, I think that's quite problematic. I think that should be definitely, it should be more inclusive, but also like if even the medical students are not particularly aware of some of these issues, like how to correct a patient and asking for their pronouns and whatnot, and how do you expect them to be fully non-maleficent, benevolent and whatnot in their profession, So these are things that matter, and these are conversations that are important to have, are actually essential to have, especially in the medical field and the whole global health community.
Yeah,
that's the first thing I would say. And then just more to I'm going to speak to my people, Cameroonians, Africans. If you've grown up in a similar background as we've mentioned here, it's okay to ask questions, and don't maybe ask questions from a place of trying to tear someone else down or trying to prove a point. Like, ask questions, learn. Someone's experience may not be the same as yours. Like, I literally learn every day, and that's the advice I would give to our listeners.
That is great advice.
Yeah. And I would, if any of our your listeners,
let's speak to you too.
Yes. If any of our listeners are funding bodies, please provide more funding for research into trans healthcare. Yeah, but on a personal level, I think that we should all be respectful, whether you're a healthcare professional or not. Be respectful, and the simplest thing I would say is don't ask someone who is trans a question that you wouldn't normally ask someone who is cis. Don't do that, because
I think the key thing is be conscious and intentional with your questions. Like, obviously, I said it's okay to ask questions, but really think, like, is there empathy in the question you're asking? Are you asking to destroy, or are you asking because you genuinely care for this person? Care for this person.
Keyword.
Yeah.
Okay. I think what you both said was great. The only few things I would add, like you're saying, how you ask the question. I personally make the distinction between, questions I might ask just a random person, maybe that I'm curious about something about their experience, versus like someone I know more personally, you know, and I'm like, okay, I know you understand that I don't mean any harm.
Yeah.
There's things I don't know, I might be ignorant about, but you know, I know they'll be willing to like take me through it, and they won't take offense to what I'm saying. They won't be too triggered. So that's one approach I'd say. And then maybe Yasmeen, you can back me up here. Like, I guess for people who may actually be exploring or questioning their gender, my only general advice is, I think it was so hard even in preparing for this episode to look at like academic papers, or to feel like I can rely on like clinical people to like, you know, give advice on certain things or how best to approach this. And I thought what was really helpful were like the different blogs I saw, different YouTube videos of just people sharing their own experience. So I feel like that's a great place to start.
Yeah, I would say the information coming directly from trans people is vital to understand what it is like for someone to experience life as a trans person. So, and oftentimes that's all you need, just to be a decent human being. You don't, I don't have to know everything about someone before it's just, I don't know, it frustrates me a lot that we have to say this, but the education is there. Unfortunately, you know, you can't force people to learn about something, but I would advise everyone to be very curious and seek information out from sources that directly from the group of people that, you know, just listen to what their experiences are, you know, and yeah, we are 3 cis women talking about this, but all of us are learning. We want to learn. We want to be corrected if something's been said that is not that is hurtful, or you know, and that's something that, you know, everyone should keep in mind. Keep an open mind, be respectful and mindful and intentional, like you said, Jocelyn, with your questions.
That was great, guys. I think we can wrap it up here.
Yeah.
Unless anyone else has any last final words, burning thoughts.
I have plenty.
Let me just feel it.
Yeah.
But thank you so much, Yasmeen, for joining us, for giving us your time. Be patient with us, correcting us. No, it's great. It was grateful to hear your perspective and from your experience and like vast knowledge, it seems.
Yeah, I could talk about this for ages.
Yeah, guys.
And also, this final disclaimer. Please bear in mind that we are young people speaking about this topic. Obviously, we've done some research here and there. Yasmeen is a GP and she has her own experience. But it is not the final end-all answer to every question we've mentioned here.
Yeah.
We are entitled to change our minds about certain questions that we've discussed here. But it doesn't mean that, oh, this is it, right? We're literally just spreading awareness around these issues. We're raising awareness around like barriers to care for trans people, and we hope to see a better space in the global health community where everyone feels included.
Yes. Couldn't have said it better myself.
Yeah.
So, Jocelyn, where can the people find us?
Okay, so please haven't yet, please follow us on our socials, on Instagram at WHI_podcast, Twitter at WHI_podcast. We also have a TikTok account if you want to see small banter. Go and follow us on TikTok. We have some funny videos on there. And please, we have a Facebook and LinkedIn account for the professionals. So whatever you use, it's called World Health Investigation. We literally are on every social media platform. So you cannot say you could not find us because we're out there.
Yeah, thanks again, Yasmeen, for joining us.
Thank you very much. And thank you, Adna. Thank you, Jocelyn.
It's been an absolute pleasure.
Yeah, and we will see you all next week.
Bye.